I'm Dr. Chris Zammit. I'm the Medical Director for Stroke and Neurosciences Critical Care for Good Samaritan Hospital and for the TriHealth Hospital System. A stroke is due to a sudden injury to the blood vessels in the brain, and that can be either a blockage of a blood vessel delivering blood to the brain or a break in a blood vessel in the brain causing bleeding into the brain. 5 out of every 6 strokes are due to a blockage of blood flow, and 1 out of 6 are due to bleeding into the brain. This is one of the challenges with stroke. It doesn't have one set of symptoms. The most common symptoms are summarized with something called B fast, where B stands for balance. That's where somebody suddenly has the difficulty with walking straight or without falling down or falling to the side. E stands for eyes, which is a problem with the eyes, which is either a sudden loss of vision or double vision. F stands for face, and that's when the face is drooping. A stands for arm, and that's where the arm may be weak, clumsy, or falling to the side. And S stands for speech, and speech can be either where someone is having difficulty enunciating the words, where their words sound garbled, they have difficulty understanding words, where they seem confused, or they have difficulty finding the words they want to say. That latter part is called aphasia, when someone is having difficulty finding the words that they want to say. The last part of BFAST is time. That's emphasized the time importance of treating stroke. Stroke is extremely time sensitive. So if someone has a sudden onset of any of those symptoms, they should go to an emergency department immediately to be evaluated for a stroke and to receive some of the very time sensitive therapies. Never try to drive somebody to the emergency department, never second guess the situation. It's all a delay in time. Stroke treatment outcomes are worsened with just 15-minute delays. A person has a lesser chance of being able to go home after their stroke. They have a lesser chance of becoming independent or remaining independent, and they have a lesser chance of being able to walk by themselves. Additionally, a 15-minute delay also increases the possibility of complications from treating a stroke. One of the biggest misunderstandings in the community is that only older people with medical problems have strokes. Anyone can have strokes. We treat people who are even in their adolescence, 18, 20-year-olds with strokes. There are certain conditions that may predispose people who are even young to strokes. We're very proud of our stroke program here at TriHealth. Good Samaritan Hospital serves as our hub for our neuroscience care and is what's called a comprehensive stroke center, as certified by the Joint Commission. We've been a comprehensive stroke center now for almost 3 years. We have our neurosciences ICU here, which has grown substantially in size, but many strokes can be managed at other hospitals, so like Bethesda North Hospital and Bethesda Butler Hospital and McCullough Hyde Hospital. They have the tools to manage patients also with strokes as well. What's important is don't dismiss the possibility of stroke because somebody is missing one of those symptoms that we talked about. You don't need to have all those symptoms, you just need to have one. And if those symptoms are preventing somebody from being able to do things that they normally can do, you need to get them checked out right away. I can't emphasize that enough.